This year at Musings, over 100 homeopaths globally came together to learn the plant kingdom in depth. I'm very excited to invite you to its grand finale of sorts, where we club the learnings of homeopathy with the beauty of our karma rituals. In this amazing setup of a farm overlooking the lake, monocotyledons group of remedies constitutes of plants which have only one cotyledon, and these remedies strive to remain whole, one. They live in their I world. This group of remedies constitutes of four subclasses and includes remedies like Triticum vulgaris, the beet, Sacrum alba, sugarcane, Lilium tig from lilials, etc. Imagine learning this plant group in tune with Mother Nature. Imagine starting your day with yoga. Add some organic whole plant based food, nature walks, meditations, healing processes. While we master our skills as healers, imagine healing yourself in the process.
What can be more beautiful than homeopathy, which helps us decipher our own inner program? This is the job of the sixth chakra. That is after which there is enlightenment. So I think when we do this method, and which such apt homeopaths, whom I have very, very high regards, Prajakta and Preeti, they're going to teach all about these plants, and I'm very, very happy for all of you. And I can only wish you all the best, and the best.
Angiosperms are divided as monocotyledons and dicotyledons. Our majority of the remedies are in the dicotyledons. So when we say the six subclasses, we are talking about the dicotyledon chart. And in the monocotyledon, there are four subclasses. A lot of species here. So you have the panas, the orchid, the grains and grasses which belong to this group. The first subclass within the monocotyledons does not have any homeopathic significance, so we can ignore it completely. The second subclass corresponds to the second subclass of dicotyledons. The third subclass botanically does not exist in monocotyledons. The fourth subclass corresponds to the fourth subclass of dicotyledons, which is about separation from mother infancy stage. So you have the grains, the grasses that belong to this subclass in monocotyledon. And the last subclass corresponds to the fifth and the sixth subclass of the dicotyledons. So in the dicotyledons, you have the fifth subclass, which is school age, and the king series, which is the sixth subclass asteroids. In monocotyledons, the last subclass is a combination, or it clubs the fifth and the sixth subclass together of the dicots. Main key words of monocotyledons: I have to stay whole. She used the word, no, that what will happen if my mother dies? I'll be devastated, I'll be broken.
There was a lot of unwinding. I probably can't explain in words how this experience was, but I always believe that people don't turn a new leaf overnight. Okay, I'm sure I didn't also, but there is something very, very soulful and very beautiful about karma. Okay, it gives you a completely new perspective, no force, and everything is voluntary. You just keep flowing with the entire journey, like the name suggests, and you probably become a better version of yourself. You don't change, or you probably don't become a different person. You become a better version of yourself. I feel a lot lighter, about 20 kgs lighter, and I feel a lot better. And I know when I go back, I have fueled myself with a lot of energy, with a lot of positivity to do even better in my life, professional as well as personal.
journey helped me to go within. And I guess that's the most important part of Karwan, that it helps you to go within.
Plant Kingdom provides us wondrous homeopathic remedies. These remedies are nothing but seeds that we are planting which have potential to blossom. Let's plant these seeds together. Let's root for each other. Let us grow together. Look forward to meeting you in person, all of you. Learning, knowing, sharing, healing, celebrating, and growing together. See you. Hello and welcome everybody. Um, and we are on the top of the hour. So let's get started. Hi, Dr. Sunita. Can I, let me see if I can. Yeah, I see you there. So before I hand over the mic to you, and I'll just make some few customary announcements, and then we'll dive straight in. Okay, so just give me a moment. I will share my screen, and here we go. So, yet another sessions, very exciting one, and very relevant, especially to the time here in India currently, you know, with all the viral fevers that are going around. But before I can introduce Dr. Sunita Gandhi and today's session, just a quick update on what's currently ongoing at Musing and what's coming up. So Defense Mechanism by Dr. Ajit Kulkarni, we just kick-started yesterday. So if you've still not joined, you can still come in. Great start yesterday. I'm personally attending it, and there's so much more to learn from Dr. Kulkarni. I'm going to be taking some basics of case taking on the 19th October. This is a free session. It's part of our classroom to clinic series that's coming up next year. So if you're students, if you're early practitioners, if you know anybody who will benefit from this, please pass on the word. You just heard that beautiful video. I really enjoyed making that with Asmita. But this is something that I'm really excited. We're going to be learning homeopathy in nature with a lot of other healing therapies, remedies like Triticum vulgare, Veratrum, Lilium tig, coconut, Arum triphylium, Saccharum album, Allium cepa, Vanilla, Colchicum. The list is so much. Monocotyledons is such a lesser known group of plant remedies. We need to learn it systematically. And I think this is a great opportunity to meet some old friends, meet some new ones, and participate in a healing journey. So welcome you to this retreat. It's going to be near Pune. Next year, on very popular demand, a lot of students came to us that some of the sessions or the courses that we run on Musings is a little advanced, and the need was to help handhold students and early practitioners, give them the confidence and the tools to bring them up from their classrooms to clinics. So this is something that we have designed. Watch out this space for more information. Asmita will share this very soon with all of you. And with that, our today's session is about um, fevers, how to diagnose them, how to treat them, how to deal with them as homeopaths. It's always tough, so this is a very relevant session, very clinical session, and I'm sure all of us are going to benefit from it. Dr. Sunita Gandhi, she's a very well known figure in the homeopathic world. She is a very regular teacher at the other song. She practices out of Mumbai. She has done her post graduation, of course, from the London College of Homeopathy under the guidance of Dr. Humran Wala. And she is such a master orator. If you attend her sessions, if you've heard her any time in the past, once she start talking, you can't multitask, you can't get distracted, you are just engrossed in the session. And you will see it if you've not heard her any time before. Today's session is going to be a testimony of that. So without further ado, I'm going to hand over the mic to her. Just some basic hygiene factors before we really deep dive in. Please keep your lines muted. Don't scribble on the screen. It's very distracting to the speakers. Keep your videos on. That way, Dr. Gandhi, she can look at you, she can interact with you, and it often avoids the temptation of multitasking. Okay. If you have any questions, raise your hand or type down your questions on the chat box. And at the end of the session, we can take them, with her. Make notes. We're not going to be sharing any slides. Enjoy the experience. And the session is being recorded. It's also being streamed live on YouTube. So in case some of your friends have not been able to join live due to other commitments, or you want to revisit this, you can see it on our YouTube channel. I have kind of posted the link at the bottom of the screen at Healing Harmony Homeopathy. You can just look it up and subscribe to the channel. And if you have any questions, here are the contact details of the coordinators. Please reach out to them. With that, Madam, you're here. I'm going to try and spotlight you. And I need to do something else. One second. All right. Welcome, and thank you for taking our invitation.
Thank you so much, Dr. Preeti, for having me here. It is an absolute pleasure to be with Musings. And she gave such a sound introduction about me. But, the dynamic duo in the homeopathic world is Dr. Preeti and Dr. Prajakta. So it is so encouraging to see the way, everybody, I mean, a lot of us senior homeopaths, we have a lot of knowledge, but to pass on to the knowledge to the newer generation is something a few do. And I am so proud of the work that this dynamic duo is doing. It is unimaginable. I was just going through her, the next array of lecture series that they are organizing. I think if I was a brand new person, I would jump at the opportunity and do all of it. And I think Dr. Preeti knows that I don't ever defer from taking any step to learn further. And we have been colleagues at the other song. I have taught her when she was doing her fellowship in homeopathy, and she has taught me when I was doing my fellowship in homeopathy. So it's, it's so strange, but I think that is how we are. Always a student. Always a student. So
that is, I think, the joy of homeopathy as well, right? I mean, we are always learning from each other. Even if we are on this side of the podium, I think we are always a student. So well said.
Yeah. So with that, I thank you again for having me here. It is an absolute pleasure to be speaking on this platform. So, and I'm going to be teaching a very important topic, something that I was always afraid of. So I thought, why not? There must be many more like me who, when they hear the word fevers, and not just like small time fever, when they hear the fevers of today's generation, the ones that we had not even heard of when we were doing our graduation. And those fevers have struck with such a bang in the past few years. And that little hitch that to take up those cases, whether I will be able to do justice, and the fevers getting so critical, requiring hospitalization. What should I do when is the question that used to come to me when these new fevers started coming in, and of course some of the old ones too. So I just felt that, something that you fear, you must address. So I really worked on that. And I think over the last few years, my fear of fevers has come down actually. And I think, a lot of us have been able to manage fevers very well. But something that was most required was how to diagnose these fevers. Therapeutics is one part, but diagnosis is another part. How do you manage the fevers? Okay, even if you know a case has come to you with dengue, what are you going to do day one? What are you going to do day two? What are you going to do day three? Would you want to hospitalize this patient? And if yes, when is the right time? Would you want to continue to treat in the clinic? You need to have that kind of confidence. That's why when this request was made to teach on therapeutics, I said that fevers is one thing, and especially now, this time when the monsoons get over, that's the time these fevers really crop up. And the end of monsoon is a critical time, and we know of late the amount of cases of dengue we have seen, chikungunya again coming up. Malaria never went away. So I'm going to be talking about some of the common fevers that come up during this time and how we will deal with it. So I will begin by sharing my screen. Yep. So the topic for today is from diagnosis to treatment of fevers in homeopathy. I hope you can see my full screen. Yes. So, yeah. So it is not just treatment, it is also diagnosis. What is fever? Fever is only an increase in the body temperature. The average body temperature is 98.6 Fahrenheit or 37 degrees centigrade. One thing I would like to tell, fever is good for you. Do not get scared of fever. Do not panic when the patient comes with high fever, or especially when young mothers come with young children having fever. Fever is a method our body fights the infection. So it is good to have that fever. Our body makes antibodies to fight the infection. So it is not necessary to bring the fever day one to normal and think everything is okay if the fever's gone the day one. There is a course the fever takes. And today we're going to learn the course of the fevers and how we will tackle them homeopathically. So I have divided my teaching session today into two parts. One is diagnosing, two is the therapeutics. And the fevers or the diseases we will discuss today are dengue, malaria, chikungunya, and typhoid. The primary ones. I mean, there are many, many more. But if you get a hang of this just at this time of the year, I think you will be able to tackle many cases. So let's begin with the dreaded word dengue. A few years back, we had not even heard the name, very few sporadic cases. And then came this whole dengue wave and, a lot of hospitalizations happening and a lot of platelets falling down and the requirement for, platelet transfusions and, people dying of dengue was something which was like news to us. And that's when we decided, okay, let's understand this disease nicely and see how we can work it and how we can help with our pathy. So what is dengue? Dengue is primarily, it's a fever, it's a mosquito-borne tropical disease. It is caused by the dengue virus. So if you ask, it's a viral fever, but it is transmitted through mosquitoes. Its spread is by several species of the female mosquito of the Aedes genus, the Aedes aegypti, as it is known. We will have the symptomatology of a lot of fevers, but how will you diagnose dengue? There is a striking feature. There is a sudden onset of fever. There is continuous fever. Fever settles only when you will give an antipyretic only for that much time. And then it starts again. It's high-grade fever. And you will have a concomitant symptom of headache, and especially headache around the eyes. It's called the orbital pains. Along with fever, there is a lot of muscle pain and some amount of joint pain. It's mostly myalgia. You have to differentiate myalgia with arthralgia. Myalgia is muscle ache. But if the joint is hurting, it is called arthralgia. There is some amount of arthralgia also, but primarily the legs are paining, the hands are paining, it's every muscle, calves are paining. That is there. And the very famous dengue rash. An alternative name for dengue is called the breakbone fever. Why? It's the pain of dengue is unbearable. You feel that every day, patients will come and say, every bone in my body is hurting, but it is actually a lot of muscle pain and some part of joint pain as well. In the first few days, when this rash appears, a lot of fevers come up with rashes. But if you want to diagnose dengue, this is the kind of rash that you will see in the initial stages of the fever. So if you will press on the chest, you will press any kind of, even if you press on the hand with the rashes, wherever the rash is, it will blanch when pressed. Can you see this mark? This is the mark. So somebody has pressed with the hand, and when you release the hand, suddenly you will see a blanched, your finger impression. That is diagnostic of dengue rash. This is only in the acute stage. If a little time has gone, then this is the rash that forms during the recovery phase, which is called a classic island of white in a sea of red. So there is a full redness, erythema, a rash, and you will see, something like white dots, in the whole bed of red. So the redness is very vibrant, plus there'll be blanched spots. This is in the end stage. So this is the two type of rash that you will see in dengue. Everybody is scared of the complications. So what can actually happen? And what are the things that we should keep our eyes open to? Usually, dengue will recover in 2 to 7 days. By 7 days, most cases do. But a small proportion of this disease will move to the complication stage, which is called the dengue hemorrhagic fever, where there can be bleeding, the platelets fall. I think that is common sense. Everybody knows platelets fall when dengue happens. But that means what? There will be free bleeding. So there can be bleed anywhere, gastrointestinal bleeding, respiratory bleeds, the platelet count falls. There can be plasma leak. That's why, in dengue, they give you fresh frozen plasma, FFPs, if you've had patients who have been admitted. So instead of giving blood, usually plasma is given. Or the patient can go into very dangerously low blood pressures. How do we diagnose? This, I think, is one of the most important slides for you to make note of. Don't be scared of dengue. You should know which test you need to do on which day. If you have kind of an inkling that, okay, it is continuous fever, it is sudden onset of fever, it has a rash that blanches on pressure in the initial phases, then, you should send in the blood works, and you can send it usually on the 3rd day. And the first 4 days, you need to do the dengue antigen, which is called dengue NS1 antigen. But if the day of the fever has progressed from 4th day, so if it is 5th day onwards, you will ask for dengue IgM antibody. CBC is a must. The first sign, I will show you what the CBC picture also looks like. I think you need to do a CBC. If it is a diagnosed, your NS1 dengue comes positive, do a CBC on a daily basis. This will help you decide whether I can continue to treat the patient in the clinic or whether I have to send him to a hospital, get him hospitalized. Because we don't want that we endlessly treat a patient and he goes into the dengue hemorrhagic stage or has a plasma leak and the platelets fall, drastically low. So if you keep doing a CBC on a daily basis, this will not happen. Because usually capillary leaks happen on the 5th day onwards. And that is one of the most dangerous complications. But it will usually happen either if the patient is less than 15 years of age, so younger, or a person who's had a previous dengue infection. How do you recognize and diagnose capillary leak? What is capillary leak? The water oozes out of the vessels. So there will be, first sign, you will see the face is puffy. The legs, it will be like a pedal edema. You know how you will see in congestive cardiac failure? That kind of, your feet can be swollen. Those are your first clinical signs. If you feel the patient has a puffed face and if the legs are swollen, you have to have your antennas risen that this patient is going into a capillary leak. Second, order an X-ray chest. Third, order a USG abdomen. The X-ray chest will let us know if there is a pleural effusion. So if there's a capillary leak in the lungs and there is pleural effusion, X-ray will pick it up with ease. Ascites is another sign of capillary leak. So if you have seen either, which is not very difficult, it's not very easy to diagnose immediately because we don't on the first day measure the abdominal girth. If the patient is hospitalized, we measure the abdominal girth every day. But if the patient sees suddenly the abdominal girth has risen or he has put on a lot of weight in 2 days, your antenna again should be higher, that let's do a USG, find out if there is ascites. Or there can be pericystic collection around the gallbladder, which also the abdominal USG will immediately find out. So, as I said, if there is abdominal pain, swelling, vomiting, fast weight gain, it gives you a clue for ascites. If there is pleural effusion, there will be a cough. So if on the day 4, day 5, there is a lot of cough with increased heart rate, another sign, okay, time for us to admit the patient. That means the primarily diagnostic tool on the 5th day, tachypnea without dyspnea, is because of capillary leak. What is tachypnea? That the respiratory rate is higher, but he doesn't really have any difficulty in breathing. There is no dyspnea. There is no, air hunger. You are only breathing very fast because of the pleural effusion. So cough with tachypnea, again, a sign of capillary leak. Very easy symptoms to locate. But, as Dr. Shankaran has always told us, the eyes will see only what the mind knows. So today, I'm just trying to put in a few things that we have seen over the last few years in our clinics when treating dengue. Another slide for all of us, especially the new practitioners who have not really gone ahead and treated a lot of dengue patients. How not to panic with low platelet count. You can save this slide if you want. This is a basic understanding how the platelets fall in dengue and why you should not panic. So the first CBC sign, when you call for the first complete blood count, the WBCs fall and it will be around 2,000 or 3,000 in number. The platelets will start falling from the 3rd to the 4th day. Platelets will continue to fall up to the 7th day. Platelets will continue to fall 1 day after the fever subsides. And why am I saying all this? This again is to see that, okay, I will continue to treat this patient in my clinic. So if the patient comes to you, let's say on day 4 of fever, and his platelets are 60,000, 70,000. Usually we don't admit unless the platelets have fallen above, around 35, 40,000. But he's 70,000 and he's on day 4. You better admit this patient because it's only day 4 and the platelets are going to still fall till the 7th day or maybe till the 8th day, till the fever subsides. And from 70, it'll become 60, it'll become 50, and God knows it can go into 15 or 20, and then they can lead to a bleed. And that can be critical for the patient. So if on the day 4, the patient is still having fever and the platelet count is 60, 70, 80,000, I think it's a good time to think that this patient is going in the wrong direction, the platelets will fall. Let's say the same patient comes to us on 7th day and his platelet count is 60,000. Would you admit? No, you will not admit that time. You know now that it's the seventh day. From tomorrow or day after, the platelets are going to rise. Even if it is 60,000 on day 7, there is no need. By the day 8th, the platelets will become probably 85, 90,000, and then it'll just keep rising every day. So don't panic. Also, if the fever has subsided today, from tomorrow, the platelets will start rising again. So you should know which day you are of the fever and what are the platelet counts on that particular day. Then you don't have anything to worry about. Hospitalization, this example I gave you, day 4 of fever, platelet count 15,000, consider hospitalization. But if the fever subsides and the platelets is as low as 15 also, you don't have to worry. The platelets will rise later. So you do check your fever and platelet count to admit. Now let's just do a little recap of what symptoms we can see in the different phases. There are primarily 3 phases of the dengue fever. This is the febrile phase, sudden onset fever, headache. You'll have orbital symptoms, mouth or nose bleeding may not happen, muscle and joint pains, definitely, vomiting, nausea, rash, diarrhea. Then you can go, if the case goes wrong and it has gone into the critical phase, then the blood pressure can drop. Pleural effusion can happen, which can easily be diagnosed with cough, with tachypnea and very little dyspnea. You can also do an X-ray chest to note the pleural effusion. Ascites, abdominal girth increases, the weight of the person can increase, and it is diagnosable on doing the ultrasonography. Gastrointestinal bleeds. And in the recovery phase, 7th, 8th day onwards also, sometimes there can be altered level of consciousness. It can lead to cerebral dengue fever. Some seizures can happen. The rash subsides, the rash is gone, but it leads to a lot of pruritus. So post-dengue pruritus is a little troublesome symptom. A lot of patients come to us, but most times it really doesn't require treatment. We go away, just moisturize your skin, keep your hydration well. Hydration is again a very, very important thing in dengue. You must see to it that the patient is aware that they need to keep their hydration very, very well in dengue. So that brings us to the end of dengue. If anybody has any questions at this point, we could take a moment to answer, and then we'll go to the next fever. I hope I've made a few things clear for you. Anybody still has any questions, we could talk now, or I could proceed further.
Oh, well, I don't see any questions on the chat for the
Okay.
moment.
Okay. All they are mute. They cannot open their mics and talk, is it?
As
Right.
of now, they are, but I can
Or they can
change
write on the
that.
chat box.
Yeah. So Dr. Ria is asking, how can we increase platelets?
Okay. So the platelets will automatically increase on their own when the fever stage gets better. All right. The platelets start increasing after the fever is over. With our homeopathic medicines, which we'll talk in the therapeutic session, we have very good medicines which will help get the platelets back also. If the platelets fall drastically low, then yes, you have to give platelets externally through the intravenous route. So when the therapeutics part comes in, I'm going to talk to you about how to increase the platelets homeopathically. But seriously, don't really get scared of the platelets dropping. Manage the temperatures, manage the fever. See to it that you're not allowing this case to go into the critical stage. And if it does go, timely intervention is something that is most required. Okay, let's.
Perfect. Yeah.
All right. Anything else? Any other question?
No. Yeah, there's one more by Dr. Zedan. What about checking oxidative stress to elevate platelets?
So I am not really aware of this. What do you mean by oxidative stress to elevate platelets?
I can try and unmute you, Dr. Zedan, if you would like to talk. Go ahead.
Hello, am I?
Yes, you're audible.
Do you hear me, please?
Yes, we do.
Yes,
Yeah,
yes.
thank you very much. Concerning the degradation of the platelets, it comes mainly as a result of oxidative stress elevation caused by the virus itself. The idea is if we can correct the oxidative stress in the body, we might be able to improve the platelets count. The idea is losing of platelets is by losing its circumference of the sialic acid. The sialic acid had been degraded by the oxidation. If we can maintain the oxidation, we can maintain the platelets, and simultaneously we are elevating the number and the activity of the platelets. Thank you.
How do you propose to do that?
Yeah.
How do you propose to reduce the oxidative stress?
We should be able to give antioxidants, and mainly we should act on the major antioxidant enzyme in the body, which is the glutathione, with selenium as a cofactor for the glutathione. We can maintain the activity of the glutathione. It is by giving an acetylcysteine, something like that, and we can give more than one antioxidant on a different level. We can help the patient.
Okay, that's a good
But
point.
this is not a homeopathy, but
Yeah.
this is a complementary for homeopathy. Thank you very much.
Good. Thank you. Thank you for the feedback.
And actually, in this part of the world, in my country, no one is acting on this principle, and they deny it even.
All
Thank
right.
you.
So thank you very much. So this was a new concept for us. This I have also not seen our practitioners here practicing. So, but it's a good point, and I think we should look into it and see where this goes. But this is not the general practice, because
Yeah.
when we are admitting patients under a physician, we see the kind of treatment that is done in the hospital, and this has not been encountered here. But I really think it's a valid point, and we should look into it. Yeah. Thank you very much.
They don't teach students at the University Faculty of Medicine. They don't teach that this principle. This is part of the holistic approach treatment of the patient.
Okay.
We don't apply it in this part of the world. So thank you.
All right. Okay. Thank you. Thank you very much. Okay, so I'll go further, and now we can go and talk about the next fever. 1 second. All right. So this brings us into the diagnostic part of dengue. Let's go to the next fever, which has been prevalent from times we don't know when. In fact, the very advent of homeopathy happened because of the medicine that cures malaria in the allopathic system, that is quinine, and that's how the first remedy, Syncona, was, or China officinalis, that is the name right now, was actually proved by mistake, and that's how homeopathy came into the being. So let's talk about malaria, which has for many years been a very primal cause of deaths with fever. So what is again malaria? Now, as we saw that the dengue was a viral infection, malaria is caused because of parasites. It's a parasitic infection, and the parasite is called Plasmodium parasite. We'll have different variants. We have the Plasmodium vivax, Falciparum, and many more. But again, it is transmitted through the mosquitoes and the Anopheles mosquito. Only the female Anopheles mosquito spreads the malarial parasite. the spread of the disease. You know, when a mosquito bites a person who has malaria, it drinks the person's blood, which contains a parasite. And when it goes and bites another person, it transmits the disease. So it injects the parasite into the other. So although the disease is caused by the parasite, but the parasite moves from one source to another, or one human to another, via the mosquito bite. So mosquitoes are a big reason for many diseases and many fevers. So now what happens once the parasite enters the body? Why I need to tell you this is because you will see the phases of fever in malaria, and again, the variant degrees, or again, the critical phase that can come in, and which phase we have to treat how. So the general method of the progression of this disease is as follows. Once the parasite enters the body, they first travel to the liver where they multiply. That is the first fever that you will see in malaria, because there is bacteremia. Then what happens is the parasite gets into the red blood cells. Then they lay their eggs there, they multiply it. So the whole red blood cell becomes big. And then the red blood cell bursts. Once the red blood cells burst, it releases more parasites into the bloodstream. So again, there will be another bacteremia and the fever will rise. So that's why we will see, the fevers rise and drop. Like in, I'm going to keep comparing the fevers. In dengue, it's a continuous rise of fever. It will only come down with antipyretics. But in malaria, even if you don't give the antipyretic, the fever will break. The fever will come down and it will rise back again. So once it has come back into the bloodstream, when the red blood cell has burst and the parasites are back, they will go and attack more healthy red blood cells. And this cycle keeps going on, and the patient becomes very sick in malaria. So this is the method. Parasite enters body, it goes to the liver, multiplies, it gets into the RBCs, multiplies further, it grows in size, RBCs burst. The moment the RBCs burst, more parasites in the blood, and the infection is increased. So the patient becomes very critical. Symptoms usually begin 10 to 15 days after being bitten by the infected mosquito. The classic symptoms of malaria is the paroxysm, the cyclical occurrence, the 3 stages. First, there is sudden coldness, the chill stage, as we homeopaths know very well. So the chill, the coldness, followed by shivering. Then there will be the spike in the fever. The temperature rises, then the temperature falls along with sweating. So the chill stage, the heat stage, and the sweat stage. So malaria will have a classical paroxysm, which you will not see in other fevers, be it any others. We'll talk about chikungunya also in some time. We'll talk about typhoid. We have already spoken about dengue. So if the fever occurs every 2 days, then we call, it is seen in Plasmodium vivax and ovale infections. But if it is every 3 days, it's called quartan fever, and we'll see it in Plasmodium malariae. The tough one, or the more serious one, is the Plasmodium falciparum. This infection, it can also lead to something called cerebral malaria, and people, a lot of us are afraid of the Plasmodium falciparum. The fever recurrence is 36 to 48 hours. Maybe it is a little less pronounced also, but again, this is almost a continuous fever, which is unlike how we see in the vivax. The early stage, so we'll have different stages in this infection. In the early stage, you will have fever with chills. So there are no chills in dengue. Then there is a lot of tiredness. There's body ache, but it is primarily the tiredness, the fatigue that gets to the person. The person has no ability to do anything. The tiredness is too much. There can be headache, nausea, and vomiting. So fever with chills and fatigue, I think, are the main things to remember for malaria. As the infection spreads, the bacteremia gets worse. When the second surge of bacteremia happens, then you will have more serious symptoms. The fever can go very high. There will be chills, there'll be shivering. You can also have convulsions. There can be GI bleeds with bloody stools, and the liver can get affected, liver enzymes get affected. You can have jaundice, seizures, mental confusion. So malaria can go and affect multiple organs. It can affect your GI, it can affect your liver, it can affect your brain. It can lead to mental fogging as well. What is a CBC picture in malaria? Keep remembering what you saw in dengue and now what we'll see in malaria. So in malaria, again, the first thing you'll start seeing is that the WBC counts fall and the lymphocyte count falls. The count is primarily neutrophilics. The neutrophils are much higher. Any which ways, when you see the ratio, neutrophils are always more than the lymphocytes. But suddenly the gap becomes much more. So the neutrophils will be about 85, 90%, and the lymphocytes will be 10 to 15%, So there's a big gap. Mostly all cells fall, the platelets fall, WBC falls, lymphocyte falls, eosinophil falls, RBC and hemoglobin also falls, which does not fall in dengue. Okay, this is a hemorrhagic, it may fall later, but in the early stages, you will see even in malaria that the hemoglobin drops from what it was normally, because you saw that the parasites infect the RBCs and the RBCs break down. If the RBCs break down, your hemoglobin level also comes down. The only two cells that are slightly higher compared to non-malarial patients are the neutrophil count and the monocyte count. So again, this picture, you can take a screenshot. You must remember this is your CBC picture, because whenever the person has fever, the first test we do is CBC. Even in that one simple CBC, you get a very good idea what this fever is like and how it is going to progress. And you can then decide your further line of action or even asks for the next line of investigations. Diagnostic test, the old we used to do CBC with MP. That was we used to have the blood smear test. Malarial parasite, when they will, a drop of blood is placed on the slide and the laboratory professional can examine it and he can diagnose it by looking at the parasites. But again, you have to send this to an investigation laboratory and get it done. So again, it will take a few hours. What we have right now with us is the rapid diagnostic test. I mean, all of us have been through the COVID waves in the last few years. And we know about the rapid test that we saw in, to diagnose COVID also. It also looks like how you diagnose your pregnancy. So there is this kit which you can buy from a lab, or you can buy from your medical store, and you just have to put one drop of your blood and in this square hole, and you wait for the result. In a few minutes, you will see this is your control line. So if it's a single line, that means no, there is no malaria. But if you see the T line, the test line also going positive, or the line appearing here, it's like in 5 minutes, you can diagnose whether you have malaria or not. And then, of course, this is just to get, okay, yes, malarial parasites are there, because this test usually looks for the proteins or the antigens which are released by the malarial parasites. But it is best to do the blood smear test to confirming the diagnosis. We also have a polymerase chain reaction, the PCR. We used to do the RT-PCR. So everybody's familiar with those words now. So PCR is also a very good test to confirm which species of malaria parasite. Because again, we have to be careful about falciparum species. Complications. As I said, multi-organ damage. Liver can get damaged, kidneys can get damaged, brain can get damaged, lungs can get damaged. So you can have a cerebral malaria, pulmonary edema, acute renal failure, severe anemia because of breakdown of RBCs or even bleeding, liver failure and jaundice. So that's why untreated malaria, we saw a lot of these complications happening. What can happen in cerebral malaria? You should be, you could pick this up in the absolute beginning. It is usually caused by falciparum variant of the Plasmodium parasite, and the symptoms are usually neurological. You will see abnormal posturing. There could be some stiffness, sudden flexion of the joints, and the joints can become a little tightened. Or you will see nystagmus, that is a quick movement of the eyeballs up and down or round and round, side to side can happen. Conjugate gaze palsy can happen, and which is easily picked up if you have seen the patient, that your eyeballs don't move together in the same direction. So you know how, like, if you've ever seen a squinted person, if the right moves, the left may not take the same path, or the left may go slightly on the other. So these are symptoms of cerebral malaria. You can pick it up immediately. You see nystagmus, you see the conjugate gaze palsy, or abnormal posturing, sometimes opisthotonus also, the whole arching of the back. When you will see, I think most of us know how opisthotonus looks like. Seizures or coma can be also symptoms of cerebral malaria. So we are done with the malaria right now. Any questions at this stage? Then we go to chikungunya. If somebody wants to write in the chat box. I think we are good to go. Fine.
Yeah, I don't see anything. Yeah.
Perfect. No, not this. Okay. Now the third fever type, chikungunya. Chikungunya, like dengue, is also a viral disease. It is transmitted again by our friendly neighborhood mosquitoes. But the virus is called chikungunya virus or the chickweed virus. The incubation period is very short, anything from 3 to 7 days after being bitten by the courier mosquitoes, and it will have classical symptoms of fever with extreme joint pains. In dengue, it was more myalgia, less arthralgia. Here, your joints are affected, and the joints, it could be your ankle joints, it could be your knee joints, it could be your elbow joints, any joint, and it can affect them very, very badly. There can be a headache, rash, and very often conjunctivitis. So fever with joint pains and conjunctivitis or eye symptoms, diagnostic of chikungunya. Fever is with nausea and fatigue. Abrupt onset of severe fever can be noticed, which can go as high as 104 degrees. Very, very high fevers initially. The joint pains are the classical symptoms of chikungunya, and these pains stay for the longest time, even after the primary infection is over. I have seen patients with months of joint pains post-chikungunya. But initially, when the fever strikes, it will be followed soon by muscle and joint pain, but the muscles are less affected and the joints are more affected. And the classical sign of chikungunya is symmetrical affection of the joints. That means if one elbow is affected, the other is affected as well. If one knee is affected, the other is affected as well. So that is a classical picture which you may not see. So in dengue, you will have some amount of joint pains, but just maybe one joint is affected or two joints, not necessarily symmetrical. Pain and joint swelling are often incapacitating and result in very severe disabilities, which can last for months. This is the rash that you will see in chikungunya. You remember the rash that we saw in dengue? The first picture was when if you press your fingers on the rash, it will blanch and you will see the blanched portion. In latter, you saw that the whole skin was flushed red and you had islands of white in a sea of red. The rash in chikungunya looks like this. It's an erythematous macular papular rash. It appears in the first 2 to 3 days, and then it subsides within 7 to 8 days. But it is more patchy. And, if you can see, the whole base is white and the rash is maculopapular. So it is raised slightly above. It is flattened, maculopapular rash, and it can be seen anywhere. Trunk in the chest, trunk, face, limbs are most affected. Conjunctivitis is a very, very strong feature of chikungunya. So chikungunya can cause conjunctivitis. Diagnosis. CBC, first thing that needs to be done. You will see WBC count is low. Platelets are low, but it's not as drastically low, or it does not fall as much as it does in dengue. There is hypocalcemia. The calcium levels fall, and it may show an abnormality in the liver function test. So you need to do your SGOT, SGPT, serum bilirubin when you are, and when you have kind of had an idea that this looks like chikungunya. So in the first 5 days, the RT-PCR can be done directly for chickpea. So how will you write the test? RT-PCR for chickpea. So you want to do the PCR test to find out whether chickpea is positive or not. Then you can have the serological test, the IgM and the IgG, that is the anti-chikungunya antibodies. Usually the IgM level, it rises from 3 to 5 weeks. So if you do IgM in the first 1 week, it's not going to come positive. When will you ask? If the fever continues and the joint pains persist post fever, then, from the 3rd week onwards, you could ask for an IgM chikungunya antibody. It will be positive, and it usually stays positive for up to 2 months. Sometimes the patient even forgets they had fever, and after 1 month, 6 weeks, they come and tell you, I don't know why I'm getting these joint pains, and they have done their RA, they have done their CCPs, and they have done their ANA, and nothing is positive. And then you go ahead and do your IgM chickpea, and you will see that it is positive. It will stay positive for up to 2 months. How will we differentiate dengue and chikungunya? Dengue, there are also lymph nodes positive in the neck and the groins. In chikungunya, there are no lymph nodes. Dengue fever can be fatal. Chikungunya, rarely fatal. It can be very debilitating. It is, I remember attending one a lecture by Dr. Tushar Shah, who's a very known physician in Mumbai, Andheri, when he was teaching us fevers some years back. He asked the audience, if you were to have dengue, malaria, chikungunya, or typhoid, which one do you don't want to have? And we were like wondering, why is he asking this? Because he said that although dengue can be fatal, malaria can be fatal, but the person who's alive is in a horrific state when they have chikungunya. Why? Because chikungunya pains can be very, very troublesome. It may not be fatal, but it is so debilitating that you are not able to do your day-to-day activities. Ask one patient who's gone through chikungunya and they will tell you. So he made a joke out of it that you don't want to have chikungunya, because if you're alive and you're facing this, it's horrible. That way. So in dengue, you may also experience bleeding because of the dengue hemorrhagic fever. Chikungunya, there is no effect to the range of having any bleeding. The muscle pains are on the back or sides of the arms. This is where you will primarily get the dengue pains. But there are no muscle pains. Chikungunya affects the joints. Joint pains are there in dengue, but they are very mild. They're not as severe as in chikungunya, but joint pains are the worst symptoms in chikungunya, and it can last for months after all the symptoms have subsided. And homeopathy does beautifully in both dengue and chikungunya symptoms in the initial stages, and also in the latter part when all the symptoms have subsided and the pains continue. So we will go to that after we finish this, our last segment in the fevers, that is the typhoid and the enteric fever. Another fever that people are very, very scared of because of the nature of the bacterial fever, also because of the relapses that happen because of typhoid. Let's understand what is enteric fever. Enteric fever, also called as typhoid, it's a bacterial disease. It is caused by the ingestion of contaminated food or water, and it is caused by the bacterium Salmonella typhi. So dengue was viral, malaria was parasitic, chikungunya was viral again. All three was transmitted by mosquitoes. Typhoid is a bacterial infection, and there is no, it's not transmitted through another animal or an insect. It primarily passes from one human to the other because the feces are contaminated or the water is contaminated. The bacterium lives in the intestine and bloodstreams of humans. It spreads between individuals by direct contact with the feces of an infected person. Very often, the food that we order from outside, I am all the time telling people that during the rainy season, see to it that you are not ordering from out and you cook in the house, because you don't know how which food is infected, how the water is infected, what are they washing their utensils with. If somebody has had typhoid, it can just kind of transmit so easily from human to human contact. We are always blaming our mosquitoes for giving us so many fevers, but not maintaining hygienic conditions can be the worst for humans, because typhoid can get transmitted so easily. There are no animals that carry this disease, so transmission is always human to human. The infection first goes to the bloodstream and then to the Peyer's patches, that's in the distal ileum. Again, why I'm telling you this, you wonder why, we are going back to what we were doing in college times and when we were studying medicine, because again, to understand the kind of fever, you'll see the step ladder form of fever in typhoid. And why do you see what the first stage looks like, and you can very well miss the diagnosis of typhoid in the initial phase, and why is it so severe in the latter phases, and why we will see that relapses are the most common in typhoid. So let's understand the mechanism. The infection first goes to the bloodstream. Okay. So once it is infected with feces or water from outside, the blood gets affected. Then Peyer's patches, which are there in the distal ileum. What are Peyer's patches? They're basically, you will find them in the distal ileum. These are your lymphatic tissues, which will actually help to maintain the bacterial flora in your intestine. And then Peyer's patches also get infected. And you will have the first line of bacteremia. Peyer's patches are small masses of lymphatic tissue found throughout ileum, region of small intestines. They form an important part of the immune system, and they monitor the intestinal bacterial populations, preventing the growth of pathogenic bacteria in the intestines. This is what you will see, the classical signs and symptoms of typhoid. This, you have the incubation period when you are asymptomatic. Then this is the phase which is the invasion phase. This is that constant typhoid stage, and this is when you start recovering. And this is the classical step ladder kind of fevers that you will see in typhoid. So classically, the progression of untreated typhoid fever goes through 3 distinct phases. And over these phases, you will see that the patient becomes more and more exhausted, more and more toxic, and more emaciated. First week, here the body temperature is not very high, like how we see in Chikungunya, high fevers, Malaria, you will see high fevers, Dengue, you will see high fevers. In typhoid, initial phases, fever is very, very average, 9900. Slowly it rises. There is relative bradycardia. That means the pulse rate is lower than the temperature it should be at. So when the temperature rises, pulse rate also should rise, but it is not in direct sync. It does not rise as much. In fact, it is lower. That's called the Fackett's sign, which is again very diagnostic of typhoid fever. Malaise, headache, and cough. Abdominal pain maybe there. So, the first signs, how will you know in the first week whether there is typhoid? I'll tell you, the fevers are not very high. There are no major organs involved. There is no diarrhea. There is no nausea. There is no platelet drop. There is no fever that is, rising to exorbitant levels. There is malaise. There is tiredness. Mild headache, cough may be present. So first you will again do CBC. What will you see? The cells, the white blood cells falling down. Here you will see relative lymphocytosis. So when we saw that there is a neutrophilic count in malaria, you will see there is a lymphocytic count, that the lymphocytes are relatively higher and the eosinophils fall. So there is eosinopenia and there is lymphocytosis. Vidal test is usually negative. Don't do Vidal test. I remember when we were doing a session of fevers with Dr. Tushar Shah. He made us all stand in the auditorium. We were like more than 150 homeopaths attending his lecture, and he said, "Everybody, put your hands forward like this, and take an oath." And we were like wondering what oath he's making us take. Is it a Hippocratic oath that we have taken in our college at graduation time? What is it? He said, मैं प्रतिज्ञा लेता हूं कि मैं टाइफॉइड के लिए कभी Vidal test नहीं करूंगा. And we all burst out laughing. He said, because don't do Vidal test. Vidal test can be negative and you will completely miss the diagnosis. So the best test which you can diagnose the typhoid fever is do the blood culture. If you see low-grade fever with a lot of malaise, tiredness, and also no organ-specific symptoms, just like you will send your NS1 dengue also, or you will do your malarial parasite or a rapid malarial test, send a blood culture. Salmonella will be quickly positive. By the second day, you will know the gram positive, gram negative bacilli is present or not. And the third day, you will know whether salmonella is positive. Within third day, you will get your test positive and you can treat accordingly. Is there a question somewhere? So Dr. Alpa Choksi was also with me when we were attending this lecture, and we had taken this oath for Vidal. Yeah, so that's nice. So no Vidal test. I think if you get that much in typhoid, also do that. Second week, the patient becomes even more debilitated. He's not able to get up at all. His fevers will become very high. So in the beginning, the fevers are not much. Then the fevers are like 104 degrees Fahrenheit. You will start seeing rose spots that come up on the chest and the abdomen. And you will also see some delirium features that come up. Abdomen will be distended and there will be pain in the right lower quadrant of the abdomen. That's where the Pierce patches are. Second week, hepatosplenomegaly, because now there is a lot of breakdown. Yeah, the liver transaminases are elevated. Vidal test is strongly positive at this stage, but why we are not to do? We will do the blood culture in the first week only, and the blood cultures are positive in the first week and sometimes still stay positive by the second week. Third week, the fevers become very high, oscillates very little over 24 hours. So it's just like a continuous fever in the third week. So no dengue would have stayed till the third week. So, when the fever persists, low grade fever 2 weeks back, and now very high grade fever, almost a clinical diagnosis for typhoid. Dehydration ensures because there is malnutrition. The patient is delirious, so is not eating or drinking much. Some of them will develop a macular rash on the trunk. Intestinal hemorrhage will happen because there is bleeding in the congested Pierce patches, where this Salmonella typhi bacteria will go and colonize. Intestinal perforation is a complication which is not seen in others, So typhoid is where the intestines can get perforated and you can have very serious complications which can often be fatal. You'll have muttering delirium or coma vigil. We have symptoms in our repertory also, picking at the bedclothes or imaginary. They're basically neuropsychiatric symptoms. How to diagnose typhoid fever in the first 48 hours of fever? Fever with no localizing symptoms that I have told earlier. No headache, no fever, no diarrhea, low-grade fever, continuous fever. First thing you do along with your CBC and the NS1 dengue, if you want to, you also ask for blood culture for Salmonella on second day. First day, if you have sent for the blood culture, you will know whether it is gram-positive or gram-negative bacteria. Salmonella is usually gram-negative. Second day, you know the organism also. So you will know that it is Salmonella positive. So by second day of doing the blood culture, you'll have a diagnosis on hand. Third day is to get the antibiotic sensitivity. This is for our friends who are treating it in the allopathic variant. So they want to know which antibiotic is suitable for this particular bacteria. So CBC will show the decreased WBC count, and it's again around 3,000, and a relative lymphocytosis. So, when the normal ratio is 80-20, 80 neutrophils, 20 lymphocytes, it almost reverses in typhoid. The lymphocytes are high, which is, very diagnostic on the first day picture also, second day picture. You can do the abdominal USG to see the terminal ileum thickening. There can also be some mesenteric lymph nodes in the right iliac fossa. Hepatosplenomegaly will be present, and there can be an acalculous cholecystitis. Vidal test, do not do. When do you hospitalize a typhoid patient? If the fever is 72 hours of continuous high fever, not responding to medication, you may consider hospitalization. Complications are toxemia, where you will have neuropsychiatric symptoms, confusional state, disorientation, delirium. Restlessness is characteristic of late-stage typhoid fever. There can be GI bleeds, GI ulcerations, intestinal perforations. Pancreatitis and cholecystitis are rare complications. The relapse. This is something that we need to know. If you feel you have treated typhoid, and, after 10 days, the patient is okay. After 15 days, there is no fever. And, you've been able to curb it. Please keep a look for relapses, because typhoids are known to relapse. And why does this happen? Because some bacteria stay in the gallbladder. They re-enter the Pierce patches and cause a reinfection. And that is not in your hand. So if that happens, see to it that it is treated again immediately. Why do you get fever in typhoid? That also first low grade, then high grade. The initial stage when I showed you, hardly any fever, 9900. And then suddenly the fever skyrockets 104. When I explained the whole cycle, how the bacteria enters the body. So when the bacteria first enters the bloodstream, low-grade fever happens, bacteremia happens. Then there's multiplication in the Pierce patches. The bacteria enters the bloodstream, causing bacteremia again. And now high-grade fever. So that is why the two different stages of fever that you will see in typhoid. Why do we first see constipation and then we see diarrhea in a patient with typhoid? When the bacteria first colonizes in the Pierce patches, it will cause narrowing of the lumen of our ileum. So there is constipation. Slowly, this will get necrosed. It will lead to diarrhea. So initially, typhoid patients have constipation. Later, they have continuous diarrhea, and that diarrhea can be debilitating. You lose a lot of nutrients. Most typhoid patients lose a lot of weight. But once all of this is controlled, slowly over a period of time, they come back. So do not panic if the patient gets debilitated. Treat it correctly. And now let's just finally distinguish malaria and dengue. You remember we did dengue and chikungunya. So differentiation, malaria will have those, I told you, it has different phases. So there's a chill phase, heat phase, sweat phase. Dengue is a continuous fever. It settles only by giving medication. Malaria will have fever, headache, backache, rarely any limb pains. In dengue, severe myalgia and arthralgia will be present, but arthralgia is not as severe. But dengue will mostly have the orbital pains. Chikungunya will have conjunctivitis, but dengue usually comes up. The headache is here. They will talk about sar dukh raha and it is paining here. Malaria has marked chill, heat, and sweat phase. Dengue, we do not have those phases. And lastly, we will see how typhoid and dengue are differentiated. So enteric fever will have low-grade continuous fever at onset, then a step ladder increase, and then there is a peak with very high fevers. There will be no localizing symptoms in the first few days. So no diarrhea, So some may have a little bit of bloating, some may have a little bit of constipation, but no other symptoms. Dengue, high grade fever with step down in the 7 days, the fever is settled. So with this, we come to the end of the diagnostic part. And now we come to how, once we have diagnosed what the fever is, how can we now treat homeopathically? So I'm going to talk about a few remedies that have given me. So this is my personal experience there. And I don't say this is the be all end all of the therapeutics. This is what I have seen in my practice that has helped me. You are free to find out more. And there may be other people who have found other remedies that are helpful. So this is not complete. I do not make any kind of statements here. This is my clinical practice. I will also share a few cases with you that have done well at different stages of the disease and how I've been able to tackle that. And the most important thing is, because I know how the disease is progressing, how am I going to be able to diagnose it and treat it at an early stage? My confidence in treating fevers with homeopathic medicines has improved. And if at the end of this session, if you're able to take that back with you also, I'm going to feel that my work is done. Because medicines, you will find out. Therapeutics, you will be able to do on your own also. But if you've understood how to come to where we have to start treating and where we do not treat, I think my job is done. So let's get into the therapeutics. Any questions at this stage before we progress further? Anybody wants to put up anything on the chat box? I'll just give half a minute break. What time have we got?
Okay. So it's going very well so far. Any
Okay.
questions, anybody?
All right, I think we can proceed then, Dr. Preeti, or somebody's put up something in the chat box.
Yeah, Dr. K, you're saying change disease presentations over a period of time. Yeah.
Yeah, that is a possibility, Dr. Keyur. So you have to see what comes at what point. This is, generally in, I think about 90% of cases, this is what we will see. But a lot of permutation combinations do happen. There are a lot of mutations that happen, and the disease presentations do change with time. So you have to keep updated with the latest in the diseases that are happening from your medical journals. So, and also I think as we spoke, Dr. Preeti and me, that we are always students of homeopathy. We had never learned about dengue in our college days. Malaria was there, but dengue we did not know of. So we have to keep updating ourselves. You keep attending lectures, like I still attend lectures from, doctors who are doing very, very well and who are more proficient with the diagnosis. So I think you have to keep updating yourself on that.
Absolutely.
Okay. Yeah. So let's proceed further. So these are some remedies I want to talk to you about which have been a very important part of my practice as acute prescriptions in fevers. And I'm going to show you some cases where I have used this, and the others I'm going to give you some clinical therapeutic knowledge. The whole theory is given in the book, so I'm not giving you full theory, but these are some of the clinical tips that I have seen over time in my practice. So let's begin with the case. So this was a 50. Again, these are excerpts. In short, I have brought up one, it will help you diagnose the case. 2, you decide the next line of action. What are the investigations you will look for, and what is the remedy you will give? So it's a 54-year-old male patient. He comes with fever since 3 days. So first thing you noted was this is day 3 of fever. It's a continuous fever with severe body ache. There are slight pain in the knee joints, but the legs are painful. Actually, the calves were very painful. It started after he got wet in the rain coming back from office. Face was red and flushed. There was pain in the eye with fever. He had a mild rash all over his body. It was extremely chilly. He wanted to cover all the time. It was better by drinking hot drinks. Just before he started shivering, he got a bad bout of cough. He was tossing and turning and unable to sit in one place, lie down in one place during fever. Classical, no? If somebody sees this, they will quickly prescribe the remedy. I mean, I think everybody knows what I'm talking about. But what I'm telling you is, let us see this in totality. What is the type of fever? Continuous high fever. There is eye pain. There is myalgia and little arthralgia. Diagnosis is probably dengue. What are the investigations that I should ask for? I should not make the patient just endlessly spend. There can be some patients who are affording, and if you write them tests for 15, 20,000, they're fine. But some patients are not affording. So you have to see to it that you will write investigations that are absolutely essential. So it is day 3 of fever. CBC is a must to do, and I call for an NS1 dengue. NS1 dengue was positive. Day 4, I got the results. The CBC showed WBC count of 3,500. That means there was leukopenia. Platelets was 110,000. It is day 4 of the fever. I can safely continue to treat. Remedy, fever after getting wet in the rain, eruptive fever, fever with pain in the legs, fever with eye pain, restlessness, fever with, during, chill better by warmth, and there was cough before fever, before the chill. And we have rust dogs crying. It was so evident in the beginning. Yeah. There was one symptom that was a little unusual. Before the chill, rust dogs, the cough before chill, rust dogs is in 5 marks, and all other symptoms are also fitting rust dogs. So it just gives a lot of confidence to give the remedy. Otherwise, it's so simple, that you start treating. What is the question? Did you consider psycho? What is psycho? Anyway, do write on the chat box what you mean by did you consider psycho. Then if I'll go to the repertory and see dengue fever, we also have eupatorium as a very, very good remedy. We have gelsemium, rust dogs, and a lot of others. But if you will see first stage, we also have rust dogs in the first stage of dengue. We also see if, it is hemorrhagic, those will be latter stages, china, ferrum, hemamelis, arsenic, secale, sulfuric acid, very good remedies for dengue hemorrhagic fever. So the remedy that was given was Rustox 1M in aqua doses. So I gave it very frequently, every 2 hours in water doses. The fever settled in 2 to 3 days. The rash disappeared on day 7. The WBC count on day 6 was 4,500. So now the WBCs had started rising, which is a positive sign. The platelets also, it dropped from 110,000 to 90,000 on day 6. Not to worry. It is going to another day or two, the WBC, the platelets will rise. So don't worry about, continuing to treat the patient. Don't worry whether the patient requires hospitalization. I continued Rustox for 2 more days, but now in QDS, 4 times a day. On day 8, WBC count had come to 5,200. Platelet count was 150,000. After that, I did not repeat the CBC, and the patient went home well. So in about 7 days, as we saw, that the dengue fever settled down. But just that if you know what is the stage of the fever, at which day, what tests are required, then you should not panic. Because if you don't panic, your patient will not panic. If you are confident that, okay, what I'm doing is great, I know where I am, the patient will sense it. It's not just your words. If your confidence is there, it will ooze out. And the patient will say, "Acha, doctor, aapne bol diya, to theek hai, we shall wait." Otherwise, the scare of dengue is so high that the patient tends to panic every time he sees, "Arey, day 4 ko to 1,10,000 tha, day 5 ko to 90,000 ho gaya, abhi kya kare?" Don't worry, day 5 hai, it has dropped, it's not gone to critical levels. Let's wait. So let's understand Rustox a little bit. Ailments from exposure to cold, damp, bad effects of getting wet after being overheated. It's very good for typhoid-like fevers also. When, it becomes like a bacteremic fever and it turns into a typhoid form. There is pain in the joints and limbs, which are worse at night. He cannot rest in any position. initial movement aggravates, better by continuous motion, classical symptom of Rustox. Now the stages of fever in Rustox, okay? The chill is very, very marked in Rustox. It's as if you're splashing cold water. The patient yawns and stretches during chill. This I have confirmed myself in the chill phase. Chill is in single parts. Chill is preceded by cough, after which you will see a dry, pleasing cough and with the taste of blood. In the heat stage, there is fizzy delirium. So you can, in Rustox, the patient can have delirious symptoms and they can break into a rash. With sweat, there is sleepiness. Generals of Rustox will also appear when you're seeing, you will see the triangular red tipped tongue. You see the corners of the mouth ulcerated. There's great thirst, dry tongue, great sensitivity to open air. They're extremely chilly and extreme restlessness, which are classical symptoms of Rustox. So this patient diagnosis wise was dengue. The symptom totality matched Rustox, and the patient settled in 7 to 8 days, did not require hospitalization. Mind of Rustox, you will see some, dreams of exertion, lot of fears, he'll be poisoned. This can come up in the delirious. In fact, I was just teaching my assistant in the morning. We were doing one case and I said, okay, actually this patient came to me for acute headaches, which was not settling with the constitutional remedy that I had given. And I made the patient sit and I tried to understand what the symptoms were. And, the whole constitutional medicine changed in the acute stage. So sometimes, the fevers or an acute symptomatology that comes up is a super window for us to actually find the constitutional remedy of the patient also. So sometimes Rustox may have been the acute medicine, but sometimes if you will see that the state of the mind also appears and it kind of corroborates with the childhood history and the fears and the dreams, you never know whether this patient was actually a patient who required a remedy from the Anacardiaceae family of the 5th subclass, or we can go on and on that. So you can take an acute malady as a superb opportunity to treat the chronic complaint as well, as also spoken about by Dr. Hahnemann in the Organon of Medicine. So yes,
so there are a couple. Yeah, sorry.
Yeah, I'm reading.
You saw them. Okay, perfect.
Yeah. So she said, why did you repeat 1M so frequently? If the fever is very high, I'm giving in aqua doses. You know what aqua doses are? You will give it in water. And so there we do not see aggravation. The moment the fever settles, we can reduce the medication. So I did give a 1M in aqua doses and then I brought it down. Don't get scared of repeating high potencies. If required, do repeat as and when. And in acute conditions, even Dr. Hahnemann in the Organon says you can give a high potency because acute infection is like an acute malady, no? So the sensitivity is heightened, so it will call for a higher potency. All right. Any more questions? So these are some modalities. I think this we all know of. Let's talk about Eupatorium perfiltratum. Somebody has a question again once again. Yes, got your point. Okay. Thank you, Dr. Bhavisha. Yeah. All right. So let's understand. Eupatorium could also have been a choice in this case. And also it's a fabulous drugs, which we know we can give in dengue, we can give in malaria, which we can give in chikungunya also. So let's understand what is Eupatorium. And when somebody asked, what Eupatorium also helps increase the platelets, but you have to see where the whole symptom match. So it is known as bone set from the prompt manner in which it relieves the pain in the limbs and muscles that accompany some of our febrile illnesses like malaria and influenza. Now, this is from our source books. It can be used even in chikungunya. It is for those long lasting pains of chikungunya. If the symptom totality matches, Eupatorium is a very good drug. It is a boon in miasmatic districts along rivers, marshes, etc. And in all conditions where there is a great deal of bone pain, says boric. Influenza and dengue, says Patak. Frequent attacks of bilious and intermittent fever, says Allen. So it is given in various kind of fevers. It is kind of documented in our source books also. Stages of fever of Eupatorium perfoliatum. What I have written in italics and boldface. Insatiable thirst before and during the chill and fever. He knows that the chill is coming because he cannot drink enough. So before the chill happens, he's so thirsty, he wants to have a lot of water. Chill usually comes in the morning, 7 to 9 a.m. one day and noon the next day. Thirst or nausea, and then violent shaking chill beginning in the small of the back. So very good for malarial fevers as well. So you have to see where the symptoms are matching. Bitter vomiting after chill or during heat. Heat, there is burning heat, and sweat relieves all symptoms, but the headache is not relieved by sweating. Miasmatic districts, no, marshy lands, in our source books, no, where they write that where there is a lot of breeding of mosquitoes, where there's marshy land, there's water accumulated. Those are called the marshy districts or the miasmatic districts. All right. This is our source book language. We don't use that as much now. All right. So sweat relieves all symptoms in Eupatorium except for the headache. Main characteristic, violent, aching, bone-breaking pains. Just like I was telling you, Dr. Tushar Shah said, you should not have chikungunya because you should not have a condition that will require Eupatorium perfoliatum because the pains are very, very violent. Tongue is yellow, taste is bitter. There is soreness in the hepatic region. There is great thirst and vomiting and purging of bile or of greenish liquid. Cough following measles, like pulsatilla, or after suppressed intermittent fevers. Coughed with sore chest, needs to support the chest with his hands. Aggravated at night is there in Eupatorium. So the closest remedy, just as I said, the chest is so sore and tender, and every time he coughs, he has to hold the chest. It's very similar to bryonia. So bryonia is also very similar to Eupatorium as far as the pain and the fever is concerned. But, the only difference is that bryonia patient likes to keep quiet. They are aggravated by least motion. They want to just stay still in one place. But the Eupatorium patient is very, very restless. They can't sit. It's almost like rust dogs. So, when you see rust dogs, Eupatorium, bryonia, you will see the patient and know if the patient is, fretting and fuming, it probably is rust dogs or Eupatorium and not bryonia. Bryonia will want not to move, just be there, and they just want no movements. And there is free sweat in bryonia, whereas Eupatorium has very scanty sweat, and whenever it sweats, it relieves all symptoms except the headache. Let's go to another case. How much time do we have? Okay. 42-year-old female patient comes with fever since 3 days. Fever comes twice a day, reaches 103 degrees. Fever is with chills. She was constantly vomiting, not able to retain water. Her eyes were sunken, lips were dry, looked very dehydrated, almost in a collapse state, very pale and drowsy. I asked, describe the fever. He said, before the fever came, I was very restless at night. I woke up in the morning. I was very thirsty and unwell, couldn't run down. And then I started sneezing. After that, the shivering started. This was followed by very high fever and I couldn't stand up. I started vomiting from then. Then after an hour or so, I started sweating profusely and felt thirsty again. Now, what do you see here? Classical. You see a chill, you see fever, and you see sweating. You also see some concomitants, restlessness the night before. You also see sneezing before the chill. Again, some concomitants, fever with vomiting. If you go back and see, it comes twice a day. It can reach as high as 103 and it can come down. Fever is with chills. What kind of fever is this? Anybody wants to write in the chat box? Diagnosis?
There is
Yeah,
malaria.
malaria. Yeah.
Yeah.
So this was malarial fever. Very good. So first thing, when the few symptoms come up, look for what is the diagnosis. And then what can you ask for? So ask for the rapid malarial test. And the test came positive. And we had certain symptoms. There was a collapse state in the fever. There were 3 stages of the fever. You had the chill, the heat, and the sweat. You had a specific prodrome. There was thirst and sneezing before chill, and there was sweat stage with thirst. So if you will go to the complete repertory, you see sneezing before fever, you have China, Arnica, Chamomilla, Cinna, and Sabadilla. Which of this is known for malarial kind of fevers? We of course know it's China. Let's see whether we find anything else. There was restlessness the night before, which we also see in China. So the remedy was given was China 1M. The symptoms for which it was selected: sneezing before chill, restlessness night before, collapse state, which is very known about China. Ailments from loss of vital fluids, well-marked phases of malarial fever. Fever settled in 3 days, vomiting stopped the same day. General health and vitals started becoming better by the next day, and the fever, she was okay by 5 days. So let's understand China a little bit. Ailments from loss of excessive fluids, especially hemorrhages, lactation, diarrhea, suppuration. Ailments of malarial origin with marked periodicity and return every other day. Pains are there in every joint and all the bones. Great debility, sensitive to touch, to pain, to draughts of air, unrefreshing sleep, or constant stupor. Prodrome of China is very, very marked. There is great thirst, manic hunger, nausea, anguish, headache, debility, sneezing, palpitation, anxiety. All of this you'll have with a general feeling of illness. In malaria, you will have this malaise, the fatigue, which is very, very marked. If the fatigue is more marked than any of the myalgia or the arthralgia, think about malaria. There was restlessness, sleep night before paroxysm, says Hahnemann. The chill is usually without thirst. The thirst ceases as soon as the chill starts. It has a very, very marked 3 different phases. It can anticipate chills 2 to 3 hours before the attack. Chininum sulf has sweat, it has thirst in all stages. Or there can be an absolute absence of thirst during the height of paroxysm. Generals of China, I think we know very well. Patient is pale, sickly, with a lot of, China is known for its flatulence and, the bowels belching, no relief. It's a hemorrhagic remedy. So we can have symptoms of hemorrhage also, and China will help there also. Gallstone colic can be there, marked debility, intermittent periodicity. It's I think, the king of periodicity, And it can also be very good for septic fevers. So we have some remedies that we will look, commonly for septic fevers. Look at China also, not just for intermittent and hemorrhagic fevers, but it's very good for septic fevers as well. Let's go to the next case. 22-year-old male patient, fever since 2 days, high grade, 103, 104, settling only with antipyretics, with dry cough, pain in the chest when coughing, thirst increase for large quantities of water, very cross and angry. So first I gave him Bryonia 1M, again, aqua doses, 3 hourly, because the fever was very high. And my standard instruction is, once the fever settles, do not repeat the medicine. So, and then I asked for CBC MP and NS1 dengue. And what do I see? Day 3, patient follows up. The fever is still very high. It has not responded to Bryonia. Right now, the fever is 100 degrees. After an apyretic, he looks very, very toxic and drowsy. The blood count had now skyrocketed. It was 17,000. It was a neutrophilic count. MP was negative. NS1 dengue was negative. What to do? There was leukocytosis. The WBC count was very high. It was The patient was in toxemia. When I examined the pulse of the patient, it was 170 per minute. Too high for the fever. That was 100 degrees at the time when I was checking the patient. And what do we know? Which remedy do we know when the pulse is way too high compared to the degree of temperature? I spoke to you about it a little while ago. Pulse rapid tachycardia out of proportion to temperature, pyrogen. And we know pyrogen is an extremely good remedy for septicemia. Yes, I think a lot of people have written no pyrogen. Yeah. So the fever did not settle with bryonia. So I didn't stick to bryonia. Third day, fever didn't rise. I did the CBC again. The WBC count had risen. This patient was not responding to bryonia. Changed the remedy to pyrogen. What happened? Patient responded very well. The WBC started reducing every day. Fever subsided in 2 days. The WBC count came back to normal in 5 days. And let's understand what happened with bryonia, why it did not work there, and how pyrogen helped. So bryonia is a good remedy for typhoid fevers. It is good for bilious, rheumatic, remittent type of fevers. Again, these are the terminologies are written in our source books. Now, it is very good when the warm weather sets in after cold days. You know, when you get heated after getting too cold, after cold drinks or ice in hot weather, after taking cold, getting hot in summer, from chilling when overheated, exposure to drafts of cold air. Again, ailments from anger, mortification, chagrin. Generals of bryonia, dryness everywhere, mouth, throat, tongue, everything is dry. Stools are dry, there's constipation, cough is dry, hoarse. Aggravation of any emotion, relief from absolute rest is a marked symptom of bryonia. And this you have to notice when the patient comes. Either it is mental or physical. There's great thirst for large quantities of water at long intervals. And complaints develop slowly and primarily right-sided. Gastric symptoms, I said constipation, because of the overall dryness, inactive rectum, no inclination to pass stools. Yeah, bryonia is dry. You're right. Stools are large, hard, dark, dry as if burnt, diarrhea during a spell of hot weather, bilious acrid with soreness of anus. Prodrome of bryonia, great thirst for large quantities of cold water and stretching and drawing of limbs, violent headache with throbbing as if the head would burst with vertigo. The child will have great thirst for large quantities. So the thirst is very, very marked in bryonia, and the dryness very marked. In the heat stage, there is violent cough. It's so, everybody knows that the cough of bryonia is so harsh and dry. There is, you will have pain in distant parts. You can have a headache with cough. You can have chest pain with cough. You can have stress and urinary incontinence because of the harsh, dry, racking cough. The patient wants to lie down, and there is sour, profuse, oily sweat, and he wants to lie down and not move in any stage. Concomitant, you will have the typical yellow coating of the tongue with dryness of the mouth and everything tastes bitter. Full rapid tense pulse, which I did not see in this case. Pyrogen is a nosode. It is a very good drug for septicemia. So it's, as this case in the beginning, I did not feel, I thought it was probably dengue, but it was actually a case of typhoid. And as it is written in Allen, for typhoid, when the best selected remedy fails to ameliorate or permanently improve, think of pyrogen. It will show remote effects of the typhoid fever. The bacteremia happens in typhoid because it's because of the salmonella typhi bacteria. It is also a good remedy for chronic malaria when, you will feel that the best selected remedy fails to act. And we have this very nice concomitant also. You have that large tongue, which is smooth as if it is varnished, but with the fetid pus-like taste, great restlessness. The bed feels hard where it is lain on. All discharges are offensive, vomiting, diarrhea, And the chill begins between the scapulae. Temperatures can skyrocket, and one of the highest temperatures can go up to 106 degrees also. But with the high fever, even with the pulse is way too high compared to the fever. Guiding symptom of pyrogen, pulse abnormally rapid out of all proportion to the temperature. So it's very, very good. Physical examination is a must when you have to touch the patient and see, you have to feel the pulse, check the blood pressure, check the temperature, see what day of fever it is. Observe how the patient comes, whether he's restless, moving, whether he's angry, how is he coughing, is he holding on to his chest, is he just wanting to sit? All of these classic symptoms that we have read again and again, we have to keep all our eyes open when they come to us in an acute situation. And then we come to arsenic, which is also very good remedy for septic fevers, for typhoid, malaria, intermittent fevers, all kinds of fevers. Very good, like pyrogen for septic fevers. What we'll see, the main guiding symptoms, I think again, arsenic is very, very well known for its prostration, burning pains better by heat, extreme restlessness, but physically weak to move, cannot rest in one place, with severe anxiety and fear of death. But here the thirst is for sips of cold water frequently. Aggravation, midnight, mid-noon aggravation. Diarrhea from decayed food. We know that, what we will see very commonly in the season that we have just passed, also in the rainy season. If you've had outside food which is old, stale food, also you will have diarrhea. Arsenic arab is one remedy that you must have in your kit immediately. Dyspnea on lying down, must sit up in bed for fear of suffocation. The stages of fever in arsenic: chill with cravings for hot drinks during chill. Heat phase is very high and there is burning, as if there is fire in the veins. Sweat with great thirst. It can have dyspnea or exhaustion. And finally, we will come to one drug which is used very, very commonly in, again, septic fevers like pyrogen and arsenic. Lactesium. Very good for typhoid fevers. There are offensive secretions, soreness of body where the part is laid on, tongue is thickly coated, stuporous condition, when the septicemia becomes so high that the person will even fall asleep in the middle of his answer and can become drowsy and stuporous, can swallow only liquids, least solid food, gags. If all of this is there, then it is a very good remedy for typhoid. And one more drug, chininum sulf, again from Rubiaceae. It's like how China, with a little bit of difference we will see between China and chininum sulf. It is used like China in intermittent fevers, like malarial fevers, with marked periodicity. But the main guiding symptom of chininum sulf is the extreme spinal sensitivity. You cannot even touch the spine of a chininum sulf patient. It is so painfully sensitive to touch in all stages of fever. Especially it is the dorso-cervical spine here, somewhere in the middle here. The thirst is present during chill. In China, thirst is present before, but it is absent in chill. When we spoke about China, they cannot drink enough water before the chill. Where the indications of any remedies are not clear and the paroxysm incomplete but regular, chininum sulf in 30 or 200 potency may clear up or cure the case, says Allens. So I have used this when I have not understood, what to give in the first stages of an intermittent fever, just to clear up the case, maybe a few doses in the beginning, and then you have clarity of symptoms and you can look for the right remedies. Because you can't say, abhi nahi mil raha hai mereko symptoms, so I will not treat. Whatever you get, I've always learned this from Dr. Rajan Shankaran. See what comes at that time. If it is there, you treat it with what you see at that time. So don't worry about what, the past was. When the acute comes, it will come with so much vivacity. It will come with so much clarity. So whatever the symptoms are coming up, take that acute totality and prescribe. So you know, I have completed my session for today. I will just give a few pointers how one can just kind of stay safe from all these mosquito-borne diseases. And these are some pointers, I mean, most of us know it, but we have to educate our patients how you can stay safe from these mosquito-borne, especially this season now when the rainy season is over. And, now the mosquito breeding happens. You don't allow water to stagnate anywhere. Even in your house, if there's some water left in the buckets, please throw away that water. Use mosquito nets or repellents as much as possible. Maintain hygiene. When you're going out in the season where it's high on the mosquitoes, please wear full sleeves clothes, eat a balanced diet, keep hydrated at all times. And how do you stay safe from waterborne diseases like typhoid? Especially the rainy season and immediately post rainy season, continue to boil your water, wash your fruits and vegetables thoroughly, try avoiding outside foods because you don't know how it will be contaminated, keep the food covered, and maintain personal hygiene. So with that, I think I come to the end of my presentation. I hope I have been able to give you little glimpses about the diagnosis and therapeutics of fever. If you have any other questions, please let me know. We have about some time left. I'll be happy to answer. Okay, somebody asked in China self-differentiation. The restlessness in China R's is something that is very typical, which will help you select, make the difference between Chinnam self and Chinnam R's. Anybody, any other questions? Dr. Preeti, if you would like to add on anything. You think I've missed something? You're my colleague, and I think you've been also treating a lot of acutes in your practice. Anything else that comes to your mind?
No, I think it was a very, very well done presentation, very well structured. I think we covered fantastically. I mean, you can see a lot of chats. I mean, it's really well done. I just wanted to see if Chanda was here and if she wanted to add, because she is also another clinician. She's been on the allopathic side for a long time, and then she's kind of come back to homeopathy. So Chanda, I don't know if you want to take a moment, if it's possible for you to add your 2 cents.
Is she there?
I see her there, but I'm not sure if she's able to.
Okay. If you want to unmute her, see that.
Yeah, I'm trying. Okay. No, I believe she's not able to. Anyway,
Okay.
so I think very well done. I think another differentiation between China us and China self is the discharges and the offensiveness of it, right? I think that is very, very peculiar. So that is something that we need to kind of keep in mind. And with COVID, I think fevers, we've had kind of a different relationship with fevers altogether, right?
Yeah.
And I was watching this one series, something on Netflix last night, and there was this one dialogue there, which I thought, when how you began your session, you said something about fears and fevers. So one of the dialogue yesterday was that the son is telling the father that you're not going to overcome your fear by running away from it. If you face your fear, that's how you're going
Fear
to overcome it.
disappears.
It
Yeah,
disappears.
face the fear and the fear disappears.
Absolutely. So
Yeah.
I think thank you so much for a well done um, you know refresher, and also a lot of new knowledge that we gathered. I think as homeopaths, clinical knowledge often is sometime a second priority or takes a back seat, isn't it? So I think this was really very, very much needed. um and what else? I think we are good to close with that. Everybody, the recording is going to be on YouTube, and please, please, please do come back to Musings. We always want to hear you and learn from you. So if your schedule allows, we'll be so happy to have you again. So thank you once again, and take care, everybody.
It was an absolute pleasure. Thank you, Dr. Preeti, for having me.
All righty. Bye. Bye,
Bye.
everyone.